Child and adolescent psychologist Dr Michael Carr-Gregg for Springvale Homemaker Centre. 30 superstores under one roof.
The AFL Drug Summit continues. We spoke to Andrew Dimitri earlier in the program when he's on the way there. Michael Carr-Gregg was, I think, the first speaker. Dr Michael Carr-Gregg, good morning.
Good morning.
What did you tell him?
I told them that I thought their policy was very good, but it needed to be strengthened, and I gave them a 5-point plan, which I know will surprise you.
Needed to be strengthened. What was your plan?
My plan was, first of all, that they should use the MMPI, which you're familiar with, that personality test, for all the recruits. And basically what that contains is what we call an APS, which is an addiction potential scale.
So you do a psychological test to see whether they've got a danger of addiction.
Likely to be, and if they were, they would be red flagged, given support and helped. The second idea was that all club captains and senior players go through a mentor program. So they're given the skills and the knowledge and the strategies to help players in trouble. At the moment, I don't think they have the psychological first aid skills or the intervention strategy, so I think it would be a good idea to put that little tier of help in. The third idea was I said we should get rid of the self-report system. I don't think self-report should count as notifications. I thought that was a silly thing that was clearly not working.
So you should be able to self-report or not?
No.
Right.
Basically, I wanted to get rid of it. And then the controversial one was that I felt that instead of 3 strikes, there should be 2. And that after the second strike, the player should be reported to the club. And my final issue was I think they need to beef up, rethink, reevaluate the drug education programs that players get, because it would appear on media reports anyway that they're not working.
How was that received?
Well, no one threw anything at me, which is always good.
They won't like the 2 strikes idea, though, and Andrew Dimitri already today has told me he wants to stay with 3 strikes.
Yep.
Why do you want to change?
The model I gave them was I thought we're dealing now with very young players, arguably, psychologically, the most vulnerable young players in the history of the AFL. I'm saying that clubs need to act in loco parentis, as a parent. So we need to think of this as a family. And if you've got kids in the family and they're doing things, you want to know about it and you want to be able to provide them with support. Clearly the fear is that some clubs, if they discovered that these people are using, and I'm talking about the CEO and the football managers, the head of football, then I think their fear is that they'd get rid of them. My argument is that what we need to have is a extensive protocol that all clubs use, whereby we exhaust every single avenue for rehabilitation and support before anybody gets delisted.
Why do you say we're dealing with such psychologically vulnerable people?
Because I think the pressures on these young men are greater now than ever before. I think the public scrutiny, particularly...
So are the rewards.
Yes, but I think that the scrutiny that they're under is unparalleled, particularly in places like Adelaide and Perth.
And the players are going to the system a lot younger, aren't they?
Well, that's what worries me. And I think that if we look at the prevalence of mental health problems in young people generally, why would they be any different? So that's why I made the statement I made.